There's a nurse who works in Nandronga in one of the provinces. She looks after 12 villages and 13 settlements. And that's a total of 3,600 individuals that she needs to serve. And the geographic location of her working environment is such that you need to walk, you need to ride a horse, you need to cross river, you need to climb mountains and go through valleys to reach members of the community in order to give the care that is needed to be given.
I recall sometimes back late 90s, there was a research done by FNA titled "Why Are the Nightingales Flying?" I was part of that research. We published that research and challenged government then that this was going to be an issue.
What we unfortunately see is some of the workers who are travelling to Australia for that better life, for that better pay, being exploited because of the temporary nature of their visa status. And so we see employers offering a job at one level, but when the workers turn up, it's something a little bit different. We know that this is having a detrimental effect on the Fijian healthcare system. We've heard about the impact at one of the local mental health hospitals. In fact, the only mental health hospital in Fiji is working at about 23% of its staffing capacity. So mental health is an area where you need a lot of one-on-one time with your carers as part of your treatment plan. But of course, it's also an area where as a staff member, you need other staff members around you to keep other patients and yourself safe.
I'll give you my example. When I was in the hospital, during my internship, I had to look after 13 to 15 patients per shift or double shift. Do you think that that affects the quality care that I need to give? Because I have to look after a certain amount of people. Because of mass migration, nurses migrating to other countries, there is a shortage in the ministry. And when there's a shortage, we have to cover. And some hospitals are running with 36% capacity. Others are running in 40%, 50%. So nurses get tired, nurses get overworked.
We certainly support the right of workers to cross borders, looking for work and looking for a better life. But we know that the migration of workers, in particular essential workers like nurses and midwives, creates issues both from the sending country and for the receiving country. For the sending country, like we are seeing in Fiji at the moment, a mass movement of nurses and midwives that Fiji desperately needs are leaving Fiji and coming to Australia to work in a lower classification area of work but earn more money. And so whilst the Australian healthcare system and aged care system benefits from that migration, because like all countries, we need more nurses and midwives, we need more carers. We know that this is having a detrimental effect on the Fijian healthcare system.
And that's when we realized we really needed to do something. And we had never, at any time in the last 10 years, reached a dwindling membership of 800. But we continue to campaign and we continue to see our way out of this. And then fortunately now, we've managed to get our membership back to over 1,000. We are telling the government here, we don't expect you to match the salary that Australia offers, but surely you can do things that will help them stay. You can give them allowances, like environmental allowances, professional development allowances, pay the risk allowances, increase the meal allowances, look at their accommodation, and above all, do something about the deplorable state of the government institutions, the medical institutions. They would like to work in an environment that's conducive to healing, an environment that's safe for them, and an environment they'll love to be in for 8 hours or 12 hours, because it's made such a way. And if government cannot do that, then they're going to continue losing nurses. You see, most of our nurses also have opted to go across to Australia.
So one of the key things that the New South Wales Nurses and Midwives Association has been doing in partnership with the South Australian ANMF branch and, importantly, the Fijian Nursing Association is lobbying both of our governments to ensure that workers' rights are central to the migration. From the Australian perspective, we are certainly advocating that our government do more. They do more to make sure that the Fijian Nursing Association gets to speak with workers before they leave for Australia, and that when those workers arrive in Australia, that our unions get the opportunity to speak with those workers as well. But I think the Australian government needs to do more, acknowledging that because of our need for aged care workers and nurses and midwives, knowing the impact that this is having on the Fijian healthcare system, we think the government needs to do more by way of development aid to ensure that the Fijian public health system is not undermined the way it is at the moment.